Hello and welcome back. My name is Andrea Bates. I'm one of the project managers with IPRO's End-Stage Renal Disease Network program. And if you've made it this far, we are at part 3 of our series, breaking down the 8 dimensions of patient-centered care. This is the third of the fourth module. And just as we did with the previous two, there are always 3 things to look for when we do these modules: the 3 main points, sample conversations, and focused resources for each area. So if you've missed the first 2 modules, that's fine. They're available for you to review. But just a little background on how the development of the 8 dimensions came to be. So they came out of Harvard research on behalf of the Pickler Institute. Studies were done, including a broad range of patients and healthcare team providers, and they were asked what they considered to be the most important aspects of patients' care. The results were grouped into the 8 dimensions or clusters, in which the patients and providers stated what would affect an overall experience of care. And lastly, every principle which will be discussed can be applied to the ESRD community and also used when creating a patient's life plan. So these 8 dimensions are patient preference, coordination of care, information and education, physical comfort, emotional support, family and friends, continuity and transition, and access to care. Module 3, we will focus on continuity and transition and information and education. Third of our fourth module, as you can see, the next one in November will cover physical comfort and access to care. So let's start with information and education and the 3 points to consider. Your facility should provide complete and accurate information about a patient's current health status. Patients may ask for additional information, and sometimes it may not be related to dialysis or align with their treatment specifically. However, as the provider, it is our role to make sure we provide them with this additional information or generate appropriate referrals. And lastly, making sure the information is presented in a way in which patients can understand. So we may need to look into things such as health literacy, if we need materials in multiple languages, as well as having access to interpreters for our patients. So this is a sample conversation that I just made up. It's actually a conversation between a patient's son, who is the main caregiver and also serves somewhat as the interpreter, as his father does not speak English, which is not his first language. So the patient's son states to you, staff members, my father speaks and reads very limited English. Spanish is his first language. I can be here for his care plans, but not at every single treatment. Are there any interpreter options so my father can receive information? Our facility has access to an interpreter service, and we have 2 staff who are bilingual. So most of the resources we share are translated into Spanish. That would be wonderful, says the patient son. Could you also send how many information or resources you have as well? This way I can review with my dad. Absolutely, we can do that. Please do not hesitate to ask us any other questions about your father's care. Your father can always reach out as well, and we will assist him. So we all know that not every facility comes equipped with bilingual staff members. This was just an example. But of course, always having access to interpreter services. This patient has a son who's very supportive, so that has a little bit of alleviation when it comes to providing care for the father. The next dimension, continuity and transition, and its 3 points, decreasing the anxiety of the patient as they start dialysis and ease into the new transition. Coordinate additional services like transportation, any other healthcare providers or support services. Again, it's generating those referrals as needed. And recognize that every patient adjusts differently to starting dialysis. While we've seen some that adjust very, very well, maybe they're the ones who have been followed by a nephrologist for many years and kind of knew dialysis was somewhere in the future. We also have those patients who, we call them, they kind of crash into dialysis and it's a whole new world for them. And it could take sometimes up to a year for a patient to adjust to their new lifestyle, even sometimes longer. So this is a sample conversation between the staff and Ms. Smith. Ms. Smith is a new patient. She's been on treatment maybe a month. And the staff noticed that she has a little bit of anxiety and seems to have a bit difficulty adjusting. Good morning, Ms. Smith. I wanted to stop by and see how you are adjusting to dialysis treatment. It has been about a month since you started. I've been doing okay, but still feel anxious sometimes when I come to treatment. Do you think there are any services to help me with my anxiety? Staff validates those feelings. Those feelings are very normal, and lots of patients have said the exact same thing. Would you ever consider joining a support group or talking to a therapist? I never thought of considering a support group or even a therapist. Can you look for any which are available in my area? I would really like that. So Miss Smith, new patient, been on treatment about a month, which means she's had probably around 12 or 13 treatments. Still feeling a little bit anxious, but staff see that maybe she could, talk to a therapist or join a support group. If your facility has any peer mentors or patient facility reps, this is a great opportunity to get them involved and ask Ms. Smith's permission if this patient can talk to her about how she's doing on treatment and just have kind of like that support buddy. So here are some resources that I've had. Life Options, which is a great website, has these 2 resources. So first, there's patient interest checklists. I have shared them with you before through one of our IPRO Learn activities. So there's 4 different checklists for patients depending on how long the patient has been on dialysis. So it has actually pre-dialysis, so CKD pre-dialysis. It has 0 to 3 months, 4 to 12 months, and then 1 year and plus. And it has a lot of questions, but it's questions that patients may not even think about until they see them and they're like, oh, these are things that maybe I can ask the facility about. There's also on the same website, the first year on dialysis, kidney questions and activities. So this is great. It has a full page of multiple questions and answers, and each question has a link and has a really nice 1-page answer guide. And it has everything from asking about what dialysis is to asking questions about insurance and diet. It is really, really good and very, very helpful. When it comes to medical interpreter services, I do know most facilities have access to interpreter services, but if you don't or are just looking for another option, the languagedoctors.org has a top 10 list of various interpreter services and how to use them. And then lastly, the AAKP, American Association of Kidney Patients, has some free PDF booklets reviewing the different stages of dialysis, and they have a very extensive overview of each phase. They've divided them into 4 phases. And then there's the Coping, Living, and Thriving with Kidney Disease booklet as well. I wanted to just tell you each of these 2 resources from the AAKP, they are long. There's 30 plus pages. And while I don't want to overwhelm a patient by giving them a bunch of stuff, it is something that maybe they can look for read during treatment or take home, only if they want to. Again, it's just more education and gives a nice extensive overview. And plus, the AAKP resources are very patient centric. So that concludes our 3rd module. Thank you for reading along, and then join us in November for our last and 4th module.